Meniscal tear involves a tear involving the cartilage inside your knee joint. All of us have two cartilages inside the knee joint, one on the inside called the medial meniscus, and one on the outer side of the knee called the lateral meniscus. So these are shock absorbers inside your joint, which help you to weight bear on your knee joint. It helps you to play sports, etc., and carry on with your day-to-day activities without any major problem. So when you have torn a part of this cartilage, it's called a meniscal tear. So a meniscal tear is typically caused by a sporting injury or some injury during your day-to-day activities. For example, whilst playing football, if you're badly tackled, you can twist your knee and you can tear your meniscus. You could equally have a twisting injury whilst coming off the curb, or your foot in a pothole, or in any other accident in your day-to-day walk of life. Now, once you tear a meniscus, you typically get mechanical symptoms in your knee joint, and these involve pain in the knee joint, which is on the inner side if it's a medial meniscus, and it's on the outer side if it's a lateral meniscus. Along with the pain, most patients typically get mechanical symptoms like clicking and locking, and any sudden twisting movement, any sporting activities can cause something moving inside your knee joint and can cause your knee joint to lock up. And this can be quite significant, quite a troublesome event, and probably hinders you with your day-to-day activities and often sports as well. So very small tears can be left alone, and you don't need to have an operation for this. And that depends on the size of the tear, depends on your lifestyle, and depends on where the tear is. So that is best judged by an experienced knee surgeon who can examine your knee joint and listen to your symptoms. So if it's a small tear, there is a reasonable chance it can be left alone without any surgery. You can carry on with your activities. And if you do not have any major problems, you're not going to make it significantly worse by carrying on. However, if it's a large enough tear and if you're quite active, you're generally best off getting this treated, and that involves surgery. That surgery is generally done through a keyhole surgery called the knee arthroscopy, during which we can trim the torn bits of the meniscus. If it's a large tear and in younger people, or if there's blood supply around it, we can repair torn bits of cartilage as well to preserve your menisci. For most people who are fit and active, generally the recommended treatment is a keyhole surgery, which is a knee arthroscopy, as I just mentioned before. With that, we can assess the tear properly, we can repair it in certain conditions, or we can trim it away so that there are no loose fragments, there are no torn fragments in the joint. This is generally the recommended treatment. In some cases, when the tear is very small, we generally recommend to leave it alone, trial of exercises, trial of return back to life, and see if that's good enough. The other condition would be if there is an established wear and tear in the joint, if there's a lot of arthritis in the joint alongside the meniscal tear. Again, we try a non-operative treatment first and see if that is good enough to keep your symptoms controlled. That's a good question, and I often see that in my practice. Somebody's twisted the knee joint, but didn't sort of just thought it's a sprained knee. In theory, they had a torn meniscus and it went untreated. Or even if they had a scan which confirmed the meniscal tear, but their life circumstances did not permit them to have it treated. What then happens is, if you are going to stress on your knee, if you have a physical job, or if you are quite sporty, there is a reasonable chance over a period of time the tear can get slowly bigger. Equally, you can have episodes of clicking or locking of the knee joint because of the torn fragments. Then your knee can swell up. And also, if these events happen repetitively, it means you're possibly damaging your articular cartilage, as in the lining of the joint, and causing some more damage to your joint.